The first case was Dr. Nagla.
Yes,
Are
Dr.
you
Sir.
ready?
Yes, sir.
Okay. Okay, Mrs. Heba is 27 years old. She has been complaining of chronic diarrhea for the last 6 months. Blood investigation and colonoscopy confirmed that she has ulcerative colitis. And the gastroenterologist decided to start steroid therapy for her. She read on the internet that steroid therapy has a lot of complications and side effects, and she decided not to receive it, and she wants to discuss with you this issue. You are research of the gastroenterology department, and you are asked to discuss this issue with her. The scenario is clear, Dr. Nagla?
Founder?
The scenario is clear?
Yes, she has ulcerative colitis for the last 6 months. The consultant decided to start the steroid, and she decided not to receive it because what she read about it in the internet.
Yes. Okay, you have
Yes,
5 minutes to
that's
prepare
it.
yourself before going to inside to meet the surrogate. These 5 minutes, Jama'a, are the most important 5 minutes to write your headlines we are going to discuss, and you have the right to read to make the list of the headlines you are going to discuss with the surrogate, and even you have the right to take the white paper with you and to make it in front of you while discussion with the surrogate.
I task your doctor and now discuss with her the management plan or discuss her decision. What is the task?
No, this is actually a scenario of counseling for side effect of drug. Your task is to convince the patient to receive steroid. She is very anxious and irritated after reading the side effects of steroid. So your task is to convince her that the steroid is the drug of choice and the best interest of her condition.
Yes, okay. Yes.
So counseling before side effect of drug can come in multiple scenarios. Actually, it can come in side effects of steroid, for example, such in this case, or maybe warfarin side effects in other case. The patient has pulmonary embolism and warfarin was prescribed for her, and she is very anxious and afraid of the side effects of warfarin. So the skeleton would be the same. It is counseling for the side effect of drug.
Okay?
You can start.
Yes. I start, doctor?
Okay, Dr. Anagda, you can start.
Good morning, Ms. Heba. I'm Dr. Naglan, the Senior House Officer in the Gastroenterology Clinic. Pleased to meet you.
Good morning, doctor. Nice to meet you.
I want to confirm that you're Ms. Heba, 27 years old. That's right?
Yes, doctor.
Okay. We're here together, Ms. Heba, today to discuss your medical condition. Is that okay with you?
Yes, doctor.
I understand that you're having chronic loose motions for the previous 6 months. And how much do you know about your condition?
Yes, doctor, I have this loose motions for the last 6 months. Doctor, they did for me some blood test and a camera test, and they told me that I have a disease called ulcerative colitis. And the gut physician prescribed for me medication called steroid that I have to be on for a long time, doctor. Actually, I read about this steroid therapy and I knew a lot of complications and side effects. I'm very anxious and I'm very hesitant to receive this drug actually, doctor.
Well, Ms. Heba, I appreciate your awareness very much, but I just want to know that how much do you know about this ulcerative colitis? Do you have any idea about this disease?
I have been told some information, doctor, like it is a long-standing disease inside my entire gut, causing some soreness. That's why they prescribed for me these medications. And they told me this medication I have to be compliant on for a long time, doctor.
Yes, Ms. Heba, that's right. Actually, ulcerative colitis is a disease which is affecting the whole food tube, which is called the colon. And it is a serious disease because it causes soreness of your whole food tube. And it is like the doctors told you, it needs to be treated because it has a lot of impaction of your life. It is causing loose motions and also can affect other parts of your body. So it is a disease should be taken seriously, not to be taken lightly. And I've understood that your consultant that decided for you medications which called steroids. You've read about it on internet, and anyone of your surroundings have received this treatment before?
No, doctor, just I got my information from the internet, doctor.
Yes, Ms. Helen. Actually, steroids, like any other medications, having its good side and the bad side. But what is the important issue we have to discuss today is the effect of this steroid on your disease. Because this ulcerative colitis that you had should be treated in a proper way. And the steroid will help increase in this soreness. And the soreness present in your colon, if not treated properly, could causing a scarring on your food tube, and on the long run can be affected in a bad way, which is even steroid will not be effective. That's why you need to start the treatment for you as early as possible, get the benefit out of it. And as you've read, it has some side effects, but what we are going to try to do with you is to do some balance between the effect, the good effect that the drug will affect, and the bad things that could happen to your disease if you don't take the medications. Am I clear for you, Ms. Heba?
Yes, doctor, and how you are going to do this balance?
We are going to try to give you the dosage of this medication, which could affect the soreness present in the colon, and at the same time, we are going to follow you up in the clinic. You are not taking the medications on your own, and we are not going to leave you for that. We are going to follow everything that this steroid can cause, and so try to prevent it or to treat it as early as possible. In the same way, we are following up the impaction of this treatment on your colon. And you have to know, Ms. Noha, that if you, Ms. Heba, that condition can become worse and worse. And at a certain point, maybe this steroid or other things cannot be effective for that. And also, these treated properly. So you this way and
Hello?
yes.
Okay.
May I ask you, Ms. Heba, do you have any, do you smoke?
What, doctor?
Do you smoke?
No, doctor, I don't smoke at all.
Do you drink alcohol?
No, doctor.
What about your food habits? Do you like spicy food?
Yes, doctor. Actually, the dietitian he make multidisciplinary team for me, and the dietitian told me to avoid spicy food as much as I can, and he make some list of types of food I have to be compliant and I have to avoid.
Yes, that's great. And you are compliant to that right now?
Yes, doctor. I'm trying my best.
That's great. And is there any member of your family having a cancer problem?
No, doctor. Why you are
That's a
asking
great
this
news.
question, doctor?
This is very important for us for looking at for having a future outlook for your case, Ms. Heba, because if no one in your family having a cancer, that would be a good point. And if any one of them having a cancer, especially in the colon or any other place, that will raise us a red flag to be worried about. Still, ulcerative colitis is a disease which should be taken seriously. And we have to take this medication in this way because this is the proper way to trying to treat it. On the other hand, there are other medications that could be also effective, but they are not giving the same effect that the steroid give and the healing properly of the soreness present in your colon. Do you have any question, Ms. Heba?
Yes, doctor. Is there any alternative, doctor, to this steroid?
Yes, Ms. Heba, there are alternatives for medications to be given in cases of ulcerative colitis. But these medications have the side effects too, because I've told you before that no medications has no side effect. Everything has its good side and its bad side. What we are trying to do is giving you the advantage of having the best side out of this medication, including soreness, and follow you up on a putting a close eye for you to try to prevent side effects. If you would like me to set another appointment with the consultant for discussion the other possibilities that you have, that would be nice for me.
Yes, doctor.
What is in your mind right now? What's going on in your mind, Ms. Heba? You can share me with your ideas and I can address any other problem that you are thinking about.
Yes, doctor. For how long I'm going to receive this medication, doctor?
You are going to take this medication for at least 6 months, and then we are going to reassess the condition according to how do you feel, according to the number of loose motions that you are having every day, and the general condition of you. This is very important in thinking about how long the medications will be continued.
Yes, doctor.
Still, do you have any other question you want me to answer?
No, doctor, actually, but I still don't feel comfortable with this medication, doctor. I feel that its side effects may be more than its benefits, doctor, actually.
Is there any particular side effect you are worried about?
I read about a lot of side effects, actually, doctor.
But no specific one you are worried about?
Yes, doctor. For example, weight gain, doctor. I think it will irritate me so much that I'll have weight gain because of this drug.
Yes, actually, Ms. Heba, I appreciate your concern very much about having gaining weight. Actually, steroid may have this gain weight, but still we can give it to you not in a tablet. We can give it to you through we can give it to you through a tube coming to your back passage, which can give the treatment locally to affect the soreness of the colon. And in this condition, we can overcome the problem of having a gaining weight.
Yeah.
What do you think
Oh
about
my God,
that?
doctor. You are going to be to give me the medication, doctor, into my bag.
And through your back passage, Ms. Heba.
It will be so painful, doctor. I don't think that I'll tolerate this way of treatment, doctor.
It will not be painful at all, Miss Heba, but if you are not feeling comfortable about that, we can think about another thing. I am trying to offer you the whole solutions for your problem, and I want you to share me in taking the decision of controlling your disease with putting in your mind it is a serious thing, should be treated thoroughly, so to prevent you from the bad outcome of it.
Yes, doctor.
Can you tell me, Ms. Heba, what do you get out from our discussion today?
Yes, doctor, I knew that I had to receive this treatment. It's a good treatment for my condition, to improve my condition. And that the benefits are maybe more than the risk or the complication of this treatment. And I have to receive it for 6 months, then to be reassessed again. Thank you, doctor.
What is your concern, Ms. Heba?
Yeah, my main concern, doctor, for how long I'm going to receive this medication, and if there any alternative treatment.
Do you have any other question or concern I can address you?
No, doctor.
Okay. Are you socially supported, Ms. Heba? You are living with whom?
I'm living with my husband, doctor, and I have 1 kid.
That's great. And you are financially supported?
Yes, doctor.
Okay, that's great too. Okay, thank you, Ms. Heba.
Thank you, doctor. 2 minutes remaining. Okay.
Okay.
Thank you, Dr. Nagla. Discussion with the examiner. Do you think the doctor convinced the patient to receive the medication?
Well, I at least make her rethink about not to take it, because maybe she will not change her mind on the spot, but it will at least rethink and reconsider taking the medication as it is for her best interest.
What did you do, doctor, to convince the patient to receive the medication?
I've explained to her the seriousness of her disease and that could be turned into cancer, and the importance of taking the medication on her health and on her improvement of general conditions, especially the chronic diarrhea that she's complaining from.
Okay, did you explain the side effects of this medication to her?
Should I explain the side effects? She already read about it.
Yeah, but you didn't ask what did she read about the side effects and what information she know about the side effects of the
I've asked her about that, and she told me, and I asked her specifically if anything is specifically concerned her. She told me about gaining weight.
Yeah, what if the patient didn't read about any side effects, specific side effect? The patient has the right to know all the side effects of the drug, isn't it?
Yes.
Okay. What's the ethical issue here, doctor?
The ethical issue in these conditions, the patient's autonomy. She has the right to know the specific condition that she has, and all the complications, side effects, and also the complications, the pros and cons of the taking or not taking steroids. The beneficence that I'm trying I'm trying to treat the patient in a proper way and non-malevolence, which is not doing no harm for the patient. And the justice should be treated equally as the other person, irrespective of her age, sex, or color.
Okay. Thank you, doctor.
Thank you.
Okay, well done, دكتورة نجلاء. يعني مش well done قوي, لكن let's do open discussion. Okay, open discussion. Anything may be missed from دكتورة نجلاء here, or anyone has any comment?
Yes, Dr. Sadiq, please. Yes.
Who is talking?
Yes, I am Dr. Magid, Dr. Sadiq.
دكتور ماجد, أهلا بيك. اتفضل يا دكتور ماجد.
ازيك؟ الله يخليك يا فندم. I think Dr. Sadiq, it is better to say to patient, we will not give you corticosteroid for long period. We will give you a corticosteroid only during the flare up of your condition, and we will stop it after your condition will become stable. This will give us a chance to convince the patient about giving her corticosteroid. Because I think the patient may misunderstand that she will take corticosteroid for a long time.
Yes. So you don't agree with Dr. Naglat that the patient will take steroid for 6 months, according to her?
I don't know exactly the period. I
Yes.
don't know exactly the time patient will take, but I'll try to convince her. We will give her as short as possible and as least as possible doses until her acute condition becomes stable. And after the condition becomes stable, stop corticosteroid.
Yeah, so generally steroids are given during the flaring up of the disease, not for
Yes.
long life. Okay,
Yes.
this is the point. Okay, Dr. Marwa? Okay, any other one has any comment?
Dr. Sadiq, we can start with flare up with prednisolone, but at the same time we can start with another steroid sparing drug like immunon azathioprine. So we can tell that at the meanwhile symptom will settle, so we can taper this steroid and we will continue over this steroid sparing drug.
Yeah, actually it is not our task here to tell the patient about the specific treatment he is going to receive, azathioprine or salicylic acid or whatever, or steroid. Our task here about is steroid, so no need to mention other treatment options there. But we have to tell the patient that steroid is given only during the flaring up, and after her condition stabilizes, we can withdraw this steroid. But still, the patient can take steroid for a long time, maybe for weeks, until her condition to be stabilized, so that she may have the side effects as well. Okay, Dr. Naha, do you have any comment?
I think if she speaks about the complication like cancer, maybe the patient will be concerned.
Dr. Naha, your voice is far actually.
I'm saying if she is speaking about the complication of ulcerative colitis, like cancer, and the high chance she will get cancer if she will not treat it well,
yes,
I think the patient will be convinced.
Okay, I agree with you. Okay.
Sir, I just want to add one thing. It's a very good case. Dr. Najla presented very well, first of all. But I just want to mention, like when she's asking the questions, you are continuously mentioning, does there is any other treatment I can get? So I think in this scenario, we have to tell the first we have to find out the severity of the disease while asking the question, how the severe is the disease. Then accordingly we can convince the patient by deciding first the severity of the disease, because in the scenario it is not mentioned how severe is the disease. So once you find out the severity of the disease, like if it's severe attack of ulcerative colitis, then it's and you can tell and convince the patient.
And how you are going to assess the severity of the disease, Dr. Farhan?
Sir, by asking a little bit of history of loose motion, how many times there is loose motion, and
Okay,
there is
let's
one
agree
criteria.
About, something here in the communication. Don't take history at all. In communication, don't take history at all. Here, Dr. Nagla asked about family history of cancer. Dr. Farhan wants to ask about how many times, if there is fever, what about hemoglobin. No, this is not our task here. It is not a case of history, it is a case of communication skill. You have a specific task you have to judge and you have to approach. Don't ask about history in the case of communication at all. Okay? So, regardless the severity, steroid is prescribed here for the patient. We don't know how long, but the patient may have the side effects. So your task is to convince the patient about the steroid and to be honest with the patient, to inform the patient about the side effects and how you are going to overcome these side effects, and to convince the patient that these side effects are outweighing the risk versus the benefit of this treatment. The benefits are extremely more. So that's why in the 5 minutes it is very important to write your headlines you are going to discuss with the patient, to organize your mind how you are going to approach. So let me to ask Dr. Nagla, what did you write in your white paper, Dr. Nagla, before going to inside?
Well, I wrote that I have to explain to her first the seriousness of her disease, especially ulcerative colitis can turn it into cancer if not properly treated. And I would raise up to my mind that it may be we need, if it's not treated well, to make a collective. But I didn't mention it in the discussion because it could raise up her awareness up to the ceiling if she knew that if we not treated her condition in a well way, that we will have to cut her colon. And I wrote that I have to discuss with her the importance of taking medications for healing. And yes, steroid has its side effect, but we can give her steroid in so many methods, including that steroid enema could be given in this case. And I would raise also the importance of having another meeting with the consultant if she doesn't accept my medications in the last. And I would like to ask her about the positive family history of cancer to raise a red flag of maybe underlying problem.
Okay, I think no need to ask about history at all. No need to ask about family history of cancer at all. Actually, even if there is no family history of cancer, the patient still has risk of cancer of long-standing and controlled ulcerative colitis. So family history of cancer or not, I think will not give us a big value here. So please don't take history during the communication session. Okay, for me, I'm going to write my headlines like that. Number 1, introduction. Okay. Number 2, giving a hint about ulcerative colitis without jargon. Number 3, advantage of steroid. Number 4, disadvantage of steroid. Number 5, how to overcome this disadvantage of steroids. And after that, I can say social history, concern, checking understanding, summary, checking understanding, and the help. This is the headlines I'm going to write in my notes before going to the station and to put it in front of me, not to forget something. Okay, so my approach would be like that. Introduction, introduce yourself, confirm the patient identity, confirm agenda of meeting, okay, and then ask the patient how much information you know about ulcerative colitis. Okay, how much information did you get from the internet about steroid to know how much information or side effects the patient know about steroid? Okay. Then I give hint about ulcerative colitis. Actually, this is not a case of counseling for ulcerative colitis, so no need to mention all the information about ulcerative. I'm going only to mention ulcerative in one line only. Okay, like you know, ulcerative colitis is a long-standing disease affecting the entire surface of the gut, causing soreness and inflammation. So, steroid was prescribed by the gut physician for you in the best interest of your condition. Then advantage of steroid. Actually, steroid is very important treatment in your condition to control your ulcerative colitis. And it was prescribed by the gut physician in the best interest of your condition. And you have to be completely compliant in your medication to to control your condition and to avoid complication of this disease. Okay. Disadvantage of steroid. Steroid, like any other treatment, has its own complications, and you have to mention all the complications of steroid. You have to be honest with the patient, actually, like weight gain, high glucose level, high blood pressure, fragile bone, some electrolyte disturbance, okay, and maybe some disturbance of your defensive system. But how you are going to overcome this complication? But we are going to do regular follow-up for your condition to be sure that you are completely free from any complications and to manage any side effects of the drug you have. And outweighing this versus the benefit of steroids, the benefits are extremely more. Okay? Okay. Then again, how to prevent the patient? Actually, ulcerative colitis is a long-standing disease and may have a lot of complications. And one of them is maybe developing cancer if your condition is controlled. But if you are completely compliant with your medication and your condition is completely controlled, the chance of cancer in your condition would be extremely rare. Like that, I finished my case, actually. And from time to time, you have to check understanding of the patient. Is it okay with you? Does it make any sense for you? Okay. So, Dr. Nagla here didn't mention any side effect of the drug, and we said that the side effects has to be mentioned all, like weight gain, high glucose level, high blood pressure, electrolyte disturbance, fragile bone, and maybe disturbance of the defensive system. And then after that, directly you have to inform the patient how you are going to overcome these complications. But we are going to do regular follow-up for your condition to be sure that you are free from any complications and to manage any side effects you have at all. Okay?
In this case, Dr. Sadiq, I should mention the side effects. I thought about if I mention the side effects that make things worse. I thought my task is to convince her with the treatment. That's why I didn't mention.
Actually, in the communication, you have to be honest with the patient. You have to mention everything for the patient. Don't hide anything at all. The patient has the right to know everything about his condition. This is autonomy. And at the same time, you have to convince the patient also to take the treatment. And how treatment is important for his condition, to control his condition, to live near normal life.
Yes, what I was thinking about, that she already had an idea about side effects. That's why I didn't mention them. But maybe I should repeat
even if the patient has or know about the side effects, you have to mention for her as well.
I have to mention them again, yes.
Yeah.
And the follow-up will be general, Dr. Sadiq, as I told her, that I will follow you closely, or I would mention that I will make an eye doctor look at you, or like that. Which of which? In general, I will follow up, or I will make an eye doctor look at you and the gland doctor check your sugar and the things like that.
You mean that every complication you are going to cover?
Yes.
Actually, no need for every complication but it's okay. When, for example, for blood pressure, we are going to check your blood pressure from time to the other. For your glucose level, we will check your glucose level to be sure that is within normal range. For fragile bones, we can give you some medication to control your bone density. It's okay, yeah. I agree with you. If you want to give treatment for each special or specific side effects, it's okay. This would be great. Okay.
Yes, great.
Okay, for the weight gain, for example, if the patient, sometimes female patients are very irritated because of weight gain. Okay, you may have this weight gain for a time, but after stoppage of this steroid, you will resume your normal weight again. Okay, this will be for only temporary time. Okay. For how long I'm going to receive this medication, doctor? Actually, this medication is given to you by the gut physician during the flaring up and activity of the disease for time. And this will be decided by the gut physician himself according to the activity of your disease.
Yes,
There is
I
no
would
other
not give her
alternative,
time.
doctor. Actually, steroid is prescribed for you in the best interest of your condition to stabilize your condition. Any other alternative treatment to be discussed with the gut physician himself.
Yes. So I will not give her a specific time. I will tell her that we are going to give you this treatment according to your response and your improvement of general condition and the symptoms. Then we are going to decide for how long you are going to take it. That's
Yes,
right?
so the duration to be decided by the gut physician according to the activity of your condition.
Okay.
And actually, I don't like to talk so much in the communication. You know, if we are talking so much, it means that you are pushing a lot of information to the surrogates, and they don't like that actually. Number two, if you are talking so much, you will make a lot of mistakes. So make your words are simple, and if you words are targeted, you know, without talking so much. Okay.
Thank you very much, Dr. Soda.
You're welcome, Dr. Nagla. So again, the headlines to put in our mind before going, this is very important. Write the headlines, your introduction, okay, introduction, give hint about ulcerative colitis and the complication of ulcerative colitis, advantage of steroid therapy, disadvantage of steroid therapy, how you are going to overcome the side effects of steroid therapy, okay, and after that, the social history involving the 4 questions: with whom the patient is living, who is supporting the patient at home, if they are doing well or not. Number 2, what's the patient job and how much her disease affecting her job and usual daily activities. Dr. Nagla didn't ask about it, and it is very important. Number 3, is the patient financially supported, smoking history, alcohol history. Then ask about the concern. Then after the concern, check understanding of the patient, do summary, or you can do summary first and check understanding later on. Help for the patient. I'm going to give you some leaflets about steroid therapy, and I'm going to give you my contact number as well. If you have any worry or query at any time, you can contact me. If the patient is still not convinced after you explained all for the patient, you can involve your consultant at the end. Okay, I can involve my consultant to convince you more about this treatment if you want. Okay, any other question here? Okay, next case will be for. I don't want to like that. Okay, Doctor. Who's going to Egypt first? Dr. Nagla and.
دكتورة نهى يا فندم
Dr.
اللي
Noha,
Egypt.
okay. Is going to Egypt. Dr. Noha, Mr. Ahmed is 27 years old. This is station 5 case. Mr. Ahmed is 27 years old. He has been complaining of neck cramp for the last 6 months and short suppress for the last 2 months for your kind care.
Shortness of breath 2 months?
Yes, neck cramp for 6 months and short suppress for 2 months. Of course, here I have to link the short suppress of the patient to the neck clamp he has, okay? There's not a case of short suppress, because short suppress has a lot of differential diagnosis or wide differential diagnosis, cardiac causes and pulmonary causes and whatever. But we have, this is very focused, station 5 is very focused and brief consultation. So you have to put in your mind that shortness of breath is related to the neck clamp of the patient.
Okay.
Okay, you will start, Dr. Noha?
Good morning, Mr. Ahmed.
Good morning, doctor. You are going to talk with Mrs. Hala, sister of Mr. Ahmed, to be used that you are in the exam. Okay.
Okay. Good morning, Mrs. Hala.
Good morning, doctor.
Good morning, Mr. Ahmed.
Good
I'm
morning.
Dr. Noha, the doctor in the medical outpatient clinic. Nice to meet you.
Nice to meet you, doctor. Okay, Dr. Noha, when you get inside the room, you saw the patient has a diffuse neck clamp and the signs of Graves' disease, actually. Okay.
Okay. Mrs. Hala, may you tell me about the complaint of your brother?
Yes, doctor, my brother has been complaining of this neck clamp for the last 6 months, doctor, and for the last 2 months he's complaining of this shortness of breath, doctor.
Is it with exertion or all the time?
This shortness of breath, doctor, or what?
Yes, shortness of breath.
Yes, with exertion more, doctor.
Does he feel shortness of breath when lying flat?
No, doctor.
Does he awake due to shortness of breath?
No, doctor.
He have any leg swelling?
Yeah, there is some leg swelling, doctor, as well.
Both legs?
Yes, doctor.
Is it when you put your finger, it makes a finger mark?
Yes, maybe, doctor, yes.
Okay. Mrs. Hala, about the neck swelling, does he sought any medical advice for it?
No, doctor.
So he's not receiving any treatment for this neck swelling?
No, doctor.
Okay. Does he have any medical problem before?
No, just this neck swelling, doctor.
And he is not receiving any medication?
No, doctor.
Okay. And does he have any cough?
Yes, there's sometimes there's cough, doctor.
Is it with phlegm or dry?
Mostly it is dry, but sometimes phlegm, doctor.
What is the color of the flag?
White, doctor.
He's smoker, Mrs.
No, he don't
Hala?
smoke at all, doctor.
Okay, good. He have any joint pain?
No joint pain, doctor.
Any skin rash?
No, doctor.
He have hot intolerance?
Yes, doctor, he has heat intolerance. He cannot, he prefer cold weather, doctor.
Any rating of his heartbeat?
Yes, doctor, sometimes.
Heart racing? He has any loose motion? Sorry?
No loose motions, doctor.
Okay. May I examine him?
Yes.
I've started with the hand. Any palmar erythema, sweating, shaking of hands?
Yeah, there is tremors with the patient, and there,
Tremors and what?
there is palmar erythema, and there is tremors.
Okay. And there is any skin rash?
You are checking something in the nails?
I'm checking if there is any thyroid acrobatry.
Yes.
Clubbing.
There is thyroid acrobatry with the patient.
Okay. And there is proximal myopathy in the arm.
Yeah, there is some weakness in the arms against resistance.
Examination of the eye, there is proptosis.
Ptosis
Looking
of
to
the
the
eyes.
eye, there is proptosis. Yes. I can't hear you, Dr. Saab.
There is no eyelids. Proptosis or ptosis?
Proptosis.
Okay.
It's the thumb.
The protrusion of the eyes already, yes. There is some protrusion, proptosis.
Okay. I will examine the thyroid infection with tips of water. Can you drink these tips of water, please?
Okay.
It is moving with tips of
It
water.
is moving. Yes, a sip of water, yes.
I will go to the back and examine. I will examine your neck, if you don't mind. If there is any pain, please tell me. By palpation, there is yes.
Not palpable. Okay, there is no tenderness.
Diffuse swelling bilateral.
There is diffuse swelling, which is soft and fixed and
Moving with tips of water.
it is moving with drinking, yes.
And I will auscultate the thyroid for any other week.
Okay.
And percussion of the sternum for retrosternal extension.
Percussion of retrosternal area for tension or metastasis, okay.
No extension.
No extension.
Okay. And I will auscultate the thyroid. Then I will see proptosis. Then I will auscultate the chest.
Auscultation of the chest, okay.
Then I will see the lower limb for lower limb edema and myxedema.
Bilateral fine crackles in the of the lungs.
Okay, and lower limb edema. There is lower limb edema.
There is mild pitting edema.
any pretibial myxedema?
No, specific edema.
Okay. Mrs. Hala, may I ask you, does your brother smoke? Drink alcohol?
Excuse me, doctor?
He drink alcohol?
No, doctor, at all.
What's his job?
He's a teacher, doctor.
How symptoms affect his daily activities?
So much, doctor.
I'm sorry for that. I will speak to the social worker, try to solve this problem for him. What about his mood? Is it good?
What about what, doctor?
The mood. Is it okay?
And he's very anxious recently, doctor.
But he thinks the life is worth it.
Think about what, doctor?
The life is still worthy for him?
Yes, doctor.
May I know what's your concern? What's his concern?
Yes, doctor. What could be the cause of this short suppressed, doctor?
Okay, Mrs. Hala, from the history I took from you and from this quick examination, I think your brother have a condition called Graves' disease, which is a disease of the gland in front of his neck. There is hyperactivity of this gland. It secretes hormone called thyroid hormone, which causes his symptoms, the heart racing and this shortness of breath. Also of this hot intolerance and anxious. In order to confirm the diagnosis, we need to do some blood tests, and we will do imaging of his neck. We will also do an imaging of his chest to see if there is another problem or no, and we might need to do scan on his heart. Is that okay for you?
What could be the cause of this short suppressed, doctor?
It might be a heart problem related to this gland problem.
Yes, doctor.
We will do an echo for him to see if there is another cause for that.
Yeah.
Is that okay for you, Mrs.
Yes.
Hala? And I think it's better to admit him at the time being.
Okay, doctor.
Okay, thank you.
Okay, 10 minutes. Of course,
10
we are
minutes?
giving.
حتى إنه أكتر من كده بكتير.
No, it's 10 minutes, but we are giving you time because of the internet delay. These interruptions, of course, will not be like the exam. Okay, discussion with the examiner. What's your clinical findings here?
The patient have thyroid acropathy in his hands, and together with pulmonary edema and tremors. He has proximal myopathy, and he has diffuse swelling, which is soft in consistency, moving with deglutition both on inspection and palpation. And he has proptosis of his eye. Most probably he has Graves' disease.
Yeah, what about the pulse, doctor? We didn't do any comment on the pulse, and you didn't examine the pulse, doctor.
Oh, I forget actually, I'm sorry.
Okay. What about the chest finding, doctor?
And he has basal crepitations of the chest, maybe heart failure due to this Graves' disease, and also maybe pulmonary fibrosis, interstitial pulmonary fibrosis.
Okay. What
And
about the
also
GVB,
immune
doctor?
condition
Did you check for GVB?
No.
Okay. So what diagnosis, doctor?
What? Sorry?
What's your diagnosis and
My diagnosis: the patient have Graves' disease, complicated by heart failure, or associated with interstitial pulmonary fibrosis.
Is pulmonary fibrosis one of the complications of Graves', doctor?
No, and it's an associated condition as an autoimmune condition, but not a complication.
Okay. What else can cause short suppressing Graves' disease, doctor?
heart failure,
Pressure could be.
anemia. I don't anemia. Compression, if there is retrocranial, if there is a huge gallster, it can compress the airway.
Yeah, did you ask about other compression symptoms of the patient, like difficulty of swallowing or a change in the voice?
No, I didn't ask.
Actually, this is very important to clarify and to rule out this is emergency. And this patient, if there is compression symptoms with him, we have to refer him directly to a surgeon. Okay. What investigation you gonna do for the patient, doctor?
I will do basic investigations in the form of CBC, liver function and renal function test, and together with thyroid function, thyroid antibodies, anti-TSH antibodies, and I will do ultrasound scan on the thyroid, chest X-ray, echocardiography. If there is heart racing, we'll do ECG also for the patient. I think this is all. That's all.
Echo?
And the inflammatory markers also. Echo, if there is suspicion of heart failure, we will do echo. So there is lower limb edema, basal crepitation.
So you have to do investigation to check your diagnosis. You are about the heart failure.
Imaging of the thyroid.
Thyroid. So you have to check. You have to make your thyroid investigations and heart failure investigations.
For thyroid, I will do imaging and thyroid function test and thyroid antibodies.
Okay. Thank you, doctor.
And for okay, thank you. Sorry, Dr.
Okay, well done, Dr. Anoha. I can we open discussion if anyone has any comment.
بس يا دكتور نور asked about the drug use for the continuum.
About what, Dr. Nagla?
أنا مش سامع أصل الصوت بيقطع. أنا بسأل إذا كانت دكتور نور سألت على الدراج ليست.
Actually, she didn't ask about drug list, but she asked this.
Asked about medication.
Medication
for anything.
Because I was thinking right here, if the patient having side effects of hyperthyroidism, he could be receiving amiodarone, which is the cause of interstitial lung fibrosis in this condition.
Amiodarone for the heart failure.
Yes, if you have disturbed rhythm or AF or supraventricular tachycardia, you could receiving amiodarone. That's why I was thinking about the side effect of it in interstitial lung fibrosis, because of the presence of the basic crackers.
But
potentially he is not on drug.
Not diagnosed to have heart failure, and he is not on medication of heart failure.
دكتور صالح السلام عليكم.
أنا دكتور ماجد وعليكم السلام.
يا فندم بالنسبه للدياجنوزس احنا هنا بنقول دايركت جريفز ديزيز ولا نقول this is a case of hyperthyroidism most probably جريفز ديزيز.
جريفز ديزيز identification اللي هم
يعني هنا it doesn't matter دكتور ماجد يعني. We have Graves sent or Graves ophthalmopathy for the patient and acropathy. So it's a clear case of Graves. So it is a case of Graves. It's most probably this patient has Graves disease, maybe secondary to hyperthyroid cardiomyopathy. This is how to interpret our diagnosis. I want to rule out that this patient don't have compression symptoms or this short suppress is due to compression because this is an emergency actually. But again, stop the short suppress long standing time. Okay, this is a case of or neck lamp for approach, which is a straightforward case in the exam and coming frequently. Before they bringing the case as a case of neck lamp, okay, but now they are making actually some modification in the exams. They are bringing the case with a side effect or complication of the case with it. So anyone can diagnose Graves' disease, but now he is taking approach to the complications of Graves'. So the scenario now is the patient and the complication of the disease he has. For example, he can bring arthritis, but anyone can diagnose rheumatoid hand. But he will tell you, for example, this patient is complaining of short suppressed also with rheumatoid arthritis. So he's checking your understanding of the complication of, or maybe this patient has pain in both hands. It's a case of carpal tunnel syndrome with rheumatoid arthritis as a complication secondary to rheumatoid arthritis. What you are going to do in this case, just to analyze the complaint, okay, and then to approach the other case as a case of neck lamp or Graves' disease. So when this short suppress started exactly, suddenly or gradually, for the same, is it coming on and off for all the time with you? Do you notice anything that increases this short suppress like exertion? And how many meters you can walk until to develop short suppress? Then, do you have this during laying down? Does it awake you from sleeping, searching for fresh air? Do you notice anything that improve your condition like rest? Okay. To ask about pulmonary symptoms and the cardiac symptoms to exclude it is pulmonary cause or cardiac cause. Any history of cough, phlegm, coughing up blood. Okay, then then cardiac. Any chest pain, racing of heartbeats, leg swelling. If you finish the analysis of the complaint, then go to the case of this neck swelling. Regarding this neck lamp, suddenly or gradually, increasing, decreasing, or the same. Then to ask about compression symptoms of any history of difficulty with swallowing, any change in the voice character. Then to ask about hyperthyroid and hypothyroid symptoms, any loss of weight. Dr. Noha didn't ask about loss of weight. How much kilograms, intended or not? What about your accident? Okay, any hot intolerance, any checking of the ears, any sweating, any loose motions. Okay, you will find the patient has hyperthyroid symptoms, so no need to ask about hyperthyroid symptoms. It's a clear case for you now that the patient is hyperthyroid with Graves'. Then ask about eye symptoms, any visual disturbance or double vision. Because the patient may have external ophthalmoplegia. What else to ask here? Then you ask about social history. Okay, you can ask the social history during examination, not to waste time, because social history is known to the all. After social history, which examination for this patient? Dr. Noha, we have to put in our mind, you have to do examination for the complaint first. This patient is complaining of short suppress, so that you have to do examination for the heart examination first to know why the patient has short suppress. Not detailed examination. You will put the cystoscope area maybe and aortic area, parasternal valvular lesion, okay, for any valvular dysfunction. And you can put the cystoscope and the lung fundus to see if there is any crackles or any crackles or any bronchi. Okay, then Graves like we used, you stand in front of the patient, look to the thyroid lamp, tell the patient to elevate his hand and then to swallow, and give the patient a sip of water to swallow and see if it is moving or not. While in front of the patient, examine for graves of ophthalmopathy as well, to see if there is any protrusion of the eyes, and see if there is any lid lag or lid retraction. Lid lag, you will find a rim of sclera below the upper eyelid. Lid retraction, rim of sclera above the lower eyelid. You have to do two or maybe 3 movements for the eye of the patient. The cross, okay, so to know if this patient has double vision or not, please follow my finger. If there is double vision, please tell me. This is a cross shape or cross movement. Then the curve movement, الهلال, to make your finger to move backwards in a crescent shape. Lid lag with the patient or not. Sorry, lid retraction with the patient or not. Then convergence, make the patient to follow your finger and then move your finger towards the nose of the patient to see if there is any ophthalmoplegia or not. Then after that, the hand of the patient, what you are searching in the hand for any pulmonary edema, for any thyroid acropathy, for any what else? For any sweating. Then examine the pulse for any tachycardia. Examine the hand is the arm is against the resistance for proximal myopathy. Behind the patient, you can do palpation of the neck lamp, palpation, okay, and then percussion for retrosternal area for extension, and of lamp for any bruit. Then you can examine the lower limb for any pitting edema or thyroid. This is examination. I know it seems that it is a lot of things you have to do in short time, but you can do it in perfect time. Okay, so what could be the cause of my brother neck lamp and short suppressed, doctor? I appreciate your concern. Mostly your brother has enlargement of thyroid gland, which seems to be active, and this short suppress may be secondary to this overactivity of the gland. So what we are going to do is to do for your brother further blood test and neck lamp and to his heart and lungs to confirm our diagnosis. Then we can disciplinary team to give him the full care and management plan. Okay. What's your clinical finds, doctor? Please, in clinical finds, don't make you have a skill called the clinical finds. In the 7 skills, you have to pass all. So if the patient has any clinical find, you have to tell it. You have to say it. So this gentleman is underweight, for example. He has diffuse neck lamp, which is with irregular edge, soft in consistency, and not tender, with bruit. Okay. So this is my comment on the neck lamp or graves. The chest examination by basal lung crackles, for example. Hand examination, there is a pulmonary edema and sweating, and there is flapping tremors, and he has eye symptoms, eye signs in the form of lid lag, lid retraction, and exophthalmos, and there is no double vision. He has bilateral mild pitting edema. So you have to put in your mind, in your interpretation of the signs of the patient. If you are going to treat the neck lamp itself, and interpret the hand, and interpret the lung, interpret the eye signs. Okay, what you are going to do for this patient? Okay, basic investigation in the form of CBC, electrolytes, kidney function, liver function, inflammatory markers, and the specific investigation of chest X-ray, echocardiography, ECG. This is for the main complaint of the patient. Okay, and then thyroid function and the thyroid ultrasound, and maybe scintigraphy. Forget autoimmune thyroid antibodies, anti-CH receptor antibody, anti-thyroglobulin, and anti-thyroperoxidase antibodies. Investigation, put in your mind what investigation you are going to do for the patient. For his chest complaint, chest X-ray, ECG, echocardiography. Okay. For his thyroid, you have thyroid function test, profile, and the thyroid ultrasound scintigraphy. Okay. Any question here for this patient? If you are asked about the treatment, any treatment your approach would be in the form of non-pharmacological treatment, in the form of patient education, psychosocial support, occupational support, and then a specific treatment if hyperthyroidism is confirmed. So anti-thyroid treatment in the form of provide Thyrocell. Other treatment options like radioiodine. Surgical intervention is the last choice in severe, enlarged, and with compression symptoms of Graves' disease. So, in the presence of short suppressing, don't forget the compression. Okay, it may be due to compression, so that you have to rule out. It will not be our first differential here, but you have to tell the examiner that in your mind that you are putting compression symptoms. Which need urgent referral. Dr. Nagla, she commented about fibrosis secondary to amiodarone. I agree with you. If the patient is diagnosed heart failure before and he's on amiodarone, so that drug list is very important to you. Everything is important to ask about. After asking about social history, don't forget medical history, family history, and the drug list of the patient. Any other question here?
يعني دكتور صابر احنا المفروض نعمل examination للهارت واللنج الاول وبعد كده الثايرويد.
Yes, it's just acting دكتورة يعني دكتورة it's just acting يعني مش you are not going to do full cardiac examination and the full examination. Heart only in the apex, parasternal area and aorta for any valvular dysfunction. And then lung examination behind of the patient. Upper, middle, and lower zone auscultation. Okay, and then you have to examine also for the neck lamp cell of Graves' disease. It's very important طبعا to ask for Graves and to check for in the examination of Graves and the complication of Graves. Okay, any other question in this case? Okay. So, I post some comments about how approaching of the case of communication and session 5. For communication, please. The 5 minutes are very important 5 minutes. After reading the scenario clearly and in details, you put your plan that you are going to discuss with the patient. Put your headlines that you are going to discuss with the patient, and get the paper with you inside and put the paper in front of you. You have to be organized in communication. Don't push a lot of information. Don't talk so much from time to time. Okay. You have to be honest with the patient, and at the same time, you have to give the patient hope, and you have to convince the patient according to the case. Okay. Even if a case of cancer with metastasis, you have to give hope for the patient, but you have to be honest with the patient. Don't give a full hope. Okay. But be honest with the patient that his condition is very advanced, but you are going to give him the full care and the best management at the same time. Don't tell the patient no hope at all, even in the palliative treatment. Okay. The pitched voice and the communication, and keep eye contact with the patient. Body language is very important. In a case of station 5, it is very focused case, so don't ask questions which is not needed at all. This will be wasting of time. We have two scenarios in station 5. A case of differential diagnosis and a case of systemic review related to the case. For example, if you approach ankylosing, okay, this is a case of systemic review of ankylosing. Approach of ankylosing. This is not a case of differential diagnosis at all. And for ankylosing, he will bring you this patient is complaining of back pain and neck pain. You have to do analysis of the back pain and neck pain, okay, and then to make systemic approach to ankylosing spondylitis. But in a case of lower limb differential diagnosis, you have to put a list of differential diagnosis. You have to ask about it. Okay. We in the lower limb swelling, chronic kidney disease, maybe nephrotic syndrome, maybe congestive heart failure, chronic kidney disease, maybe hypoalbuminemia related to malabsorption. So that you have to ask about all of these. So these are the two scenarios coming in station 5: a case of differential diagnosis and a case of systemic review related to the case. What I'm saying is clear or simple for all. Okay.
معلش دكتور صادق ممكن تاني؟
Okay, in station 5, you have two scenarios in station 5 coming in the exam. A case of differential diagnosis, for example, chest pain. This is a case of differential diagnosis. Maybe cardiac chest pain, ischemic heart disease, maybe endocarditis, myocarditis, epicarditis, or maybe pulmonary embolism, pulmonary edema, pneumonia, whatever. What I mean, it is a case of differential diagnosis. Chest pain or lower limb edema, for example, in station 5. But maybe another scenario is a systemic review related to the case. I mean, if he brought you a case of arthritis with pain in both hands, and this pain mostly is carpal tunnel syndrome. So, systemic review related to rheumatoid. You have to ask about other systemic review related to rheumatoid arthritis. You have to ask about lung symptoms, cardiac symptoms, and kidney symptoms. This is a complication of rheumatoid arthritis. I don't know if what I'm talking about is clear or not. Okay. So station 5 depends mainly on the practice. It is 8 minutes only, so you have to do a lot of breaks on station 5. The cases of station 5 are repeated. They are only maybe from 30 to 40 cases. So you have to make a lot of breaks in station 5 case in proper way, not to miss something. I think if you review the papers that I wrote before, I think it's covering everything, very focused, without making a lot of effort actually. Okay, I was tending to make another case of history, but I think time is running. So later on, inshallah, we will cover 3 cases from every station. I'm so grateful for your attendance today.
Thank you, Dr. Sadiq.
Thank you very
Thank you,
much,
sir.
Dr. Saad.
Thank you very much.
Dr. Sadiq.
للجميع يا رب ونشوفكم على خير يا رب دايما.
يا دكتور صادق، طب 9:30 يا دكتور صادق، الله يخليك.
إيه؟
9:30.
إيه؟
9:30. 9:30.
Someone is talking but
9:30 انا فايد انا.
شايف حد بيتكلم بس انا مش سامع.
صادق. ايوه انا فايد يا دكتور صادق.
دكتور فايد اهلا بيك والله منور.
ازيك يا مان؟ خليها 9:30 يا دكتور صادق الله يخليك.
خليها 9:30 توقيت السعودية.
ايوه يا فندم ايوه كويس.
من عينيا يا دكتور فايد.
امتى يا دكتور صادق؟
ايه؟
امتى ان شاء الله؟
تاني امتى والله انا مش عارف يعني it's according to يعني the suitable time ان شاء الله.
ان شاء الله. شكرا.
in the near ان شاء الله.
ماشي يا فندم.
ألف شكر يا دكتور سعد، ميرسي
شكرا
جدا.
لله، نشوفكم على خير باذن الله جميعا. السلام عليكم.
إن شاء الله، مع السلامة.
سلام.
شكرا دكتور صادق.
Thank you dear.